Hi everyone, thank you so much for being here. I'm Kaleigh. I am a chronic illness patient advocate and content creator, also a chronically ill and disabled person. I help patients learn how to advocate for themselves in the medical system and how to navigate the diagnostic process, as well as the medical system. Thank you for being here. I also want to thank Alex, who cannot be here tonight, and Sarah for hosting and creating a space for this conversation to be had. Thank you for having me. As a disclaimer, before I get started, my brain's working a little slow today. Thank you, chronic illness brain. So I may be relying a little bit more on my notes than usual, but I will do my best to keep you engaged. And I also want to take a second to acknowledge COVID safety. I always wear a mask when I'm in public, but tonight I'll be unmasked while speaking, so my symptoms don't flare and impact my ability to get through this. I will be masking again afterward. Something I'll come back to throughout my speech is access. Precautions like wearing a high-quality mask in public are part of accessibility. We can't tell who in a space is immunocompromised or disabled, and many people avoid spaces just like this altogether because they're just not safe for them. When we talk about rethinking healthcare and creating change, we also have to think about the people whose voices aren't in the room because the space wasn't accessible to them in the first place. And if we're serious about access, that has to show up in our actions, like right now masking in shared spaces, not just our conversations. So thank you to those of you who are masking tonight and those of you who took COVID precautions. It is much appreciated. So now, before I get into my story, I want to be very clear about something. I am not an outlier. This is not just a series of unfortunate events. My experience is not rare. Millions of patients have lived some version of this story, and the details may be different, but the trajectory is often the same. It's what happens when your labs come back mostly normal or non-specific, when your symptoms are largely invisible, when there are clear red flags and abnormalities, but no one can connect the dots. It's what happens when you have complex and overlapping conditions in a medical system organized around separation. Care is divided across specialties, training is divided, and diagnosis is often reduced to single isolated conditions. In a one-size-fits-all structure, patients who don't fit get left behind. That's how care can become more of a burden than the illness. I have several chronic conditions, but today I'll be talking almost completely on my POTS, which stands for postural orthostatic tachycardia syndrome. It's what affects me most day to day. It's where I ran into the biggest barriers in getting diagnosed and treated, and it was my gateway diagnosis for getting diagnosed with my other conditions. POTS is a type of dysautonomia. Dysautonomia is a group of autonomic nervous system disorders where the autonomic nervous system is dysfunctional. The autonomic nervous system regulates the involuntary responses of the body, the responses we cannot consciously control: heart rate, blood pressure, respiration, digestion, kidney function, and more. So when that nervous system is dysfunctional, that can cause dozens of symptoms across multiple body systems. The hallmark of POTS is an increase in heart rate of at least 30 beats per minute within the first 10 minutes of standing. And this orthostatic tachycardia, which I promise I am experiencing right now, 132, also comes with symptoms like lightheadedness, dizziness, fatigue, brain fog, and sometimes fainting. So this is an inconclusive list of POTS symptoms, and as you can see, POTS affects the entire body. When I first got sick, I was the happiest and healthiest I'd ever been. I had just moved to Chicago for grad school to study opera about 6 months before, and in the year and a half before that, I'd also lost a lot of weight, so I felt really good. I say all of this because when you have seemingly invisible chronic illnesses, especially if you are a woman, you're often told by at least one provider, you're not sick, you just need therapy. You just need to lose weight and you'll feel better. I heard variations of this advice several times over the next 20 months it took for me to get diagnosed, despite my reality being the exact opposite. And in this, I am not an outlier. I woke up one day in March 2022 feeling lightheaded, dizzy, and weak. At first, I thought that I was having low blood sugar episodes, but then I started fainting, so I went to my primary care doctor. She ran the usual labs, saw I had elevated platelets, elevated inflammation markers, told me you probably just have a virus, let's follow up in 3 months. Over the next 3 months, I started getting sicker. I started sweating excessively, so much so that I arrived at school one day and one of my friends oh my God, is it raining outside? No, girl, just me, but thanks. I also developed fatigue, debilitating GI issues, neuropathy, extreme facial flushing, and my lightheadedness and dizziness continued to worsen. So I followed back up with my primary care doctor. She sent me to Hematology for the elevated platelets. Hematology said no big deal, and then a month later I went to Rheumatology. My rheumatologist was in the room with me for maybe 5 minutes. I hope you enjoyed my crying selfie. And he looked at my hands and said, "You don't need any testing. You need to drink more water." Super helpful, thanks. After that, I went to GI, and this was the first time that I was treated like a teammate and an equal and a human, a partner in my own care, not just a patient to manage. He listened and he validated my experiences, and within a few weeks, I had a colonoscopy, an endoscopy, and the findings were mostly non-specific, but for the first time, I felt seen and heard, and that gave me a lot of hope moving forward until my primary care doctor stopped moving things forward, and I was left to try to navigate the maze of specialists and the search for answers on my own. This happens to so many people with complex conditions, and it's this lack of guidance that contributes to diagnostic delays, misdiagnoses, and unnecessary suffering. At that point, I decided to see an allergist. I didn't really know what to do. I was like, what specialists do I know that I haven't seen? Okay, allergy. I learned I'm allergic to poplar trees, which I don't think I could identify one even if I was in a forest of them, but that's good to know. And also, apparently I'm allergic to cats, which is funny because my friend Emily went with me to this appointment, and going in I said, well, I know one thing's for sure, I'm definitely not allergic to cats. So it was very enlightening appointment. Around that time, one of my classmates who had POTS suggested I see a neurologist. Up until then, I really didn't know anything about it, but as I had done research, I realized a lot of what I was experiencing seemed to line up pretty closely with it. So I found a neurologist on my own. I mentioned POTS, and he actually tested me for it. You can test for POTS with a variation of orthostatic vitals. The protocol's a little different, so you lie down for 5 to 10 minutes. After that time, you take your heart rate and blood pressure, then you stand, immediately take your heart rate and blood pressure, and then you continue standing for 10 minutes and take your heart rate and blood pressure at 2, 3, 5, and 10 minutes of standing. He performed the test incorrectly by having me sit between lying down and standing. And he also failed to recognize that I was on a beta blocker, which is the first line treatment for managing tachycardia and lowering heart rate in POTS. So of course, both of those things masked my true autonomic response, so I was not diagnosed with POTS. I didn't meet the POTS diagnostic criteria. He told me, you definitely don't have POTS, but do me a favor and let me know when you figure out what it is. That should have been the moment I was diagnosed, and I wasn't. Unfortunately, that neurologist was misinformed, or maybe just not up to date on the most recent consensus for POTS, but that misstep led to 9 more months of being passed from specialist to specialist, seemingly endless tests, appointments, procedures, while my symptoms worsened and I got sicker. And this part of my story is all too familiar for POTS patients, and it reflects a broader gap in siloed clinician training and pattern recognition for complex multi-system conditions. This gap becomes especially visible in conditions like dysautonomia and POTS, not because they're rare, but because they're complex and often poorly recognized in a system that is built around separation. Most medical schools in the US offer up to 2 hours of instruction on dysautonomia, if they even offer it at all. 2 hours or less. There are 65 board-certified autonomic nervous system disorder specialists in the United States for more than 40 million Americans with some type of dysautonomia. Structural gaps like these lead to significant diagnostic delays. The average time from symptom onset to a correct POTS diagnosis is 7.7 years. These gaps lead to misdiagnoses. Between 69 and 83% of POTS patients, depending on the study, report being misdiagnosed with a psychiatric condition before receiving their correct POTS diagnosis. And they lead to astronomical wait times. My POTS specialist is booking out to May 2028 right now for both new and established patients. I haven't seen her since July 2025. And while I'm talking about these outcomes in the context of POTS and dysautonomia, these patterns are not unique. They reflect what happens when complex conditions don't fit neatly into boxes. So how does my platform, social media, technology come into all of this? After that neurologist told me I don't have POTS, I didn't know where else to go, so I went to Cleveland Clinic. I was able to see an internist virtually first, who arranged for me to see several specialists there, and he ordered a 24-hour urine test for a condition he wanted to rule out. I was able to do that collection at a lab here in Chicago, fortunately or possibly unfortunately. As you can see, it was not a good time. It sounds exactly what it is. 24-hour urine collection, but you get to keep it in your fridge the whole time. So I begrudgingly, I did it, and I sent it off to the lab, and then a few weeks later, my doctor messaged me and said, "Are you still planning to do the urine collection?" What do you mean? What do you mean? Yep, the specimen wasn't received. They lost it. The job was gone. So that kind of, understandably, I feel, sent me spiraling. I decided, who is going to understand about this? Who could possibly understand what I'm going through? So I went to social media naturally. I made a video telling this whole story from, it's probably a virus, come back in 3 months, to the specimen wasn't received, we don't know where the urine jug is. And that video happened to go viral. Hundreds of thousands of people became invested overnight. Many of them, of course, wanted to find out how the story ends. What was the mystery illness? But even more stayed engaged because they saw themselves in me. They too had lived this. These are just a few of the thousands of comments from that video. They followed me because they wanted and needed to connect with people going through the same things. This is me. This type of story is so typical. You're telling my story. Are we living the same life? I have zero original experiences. This is the story of my life. What I learned on day one of posting and what I have continued to see over the last 3 years as a content creator and patient advocate is that patients are searching. They are researching. They're trying to understand what's happening in their bodies, and a lot of the time they're doing it in the absence of clear, accessible medical guidance. Just like I was when I was lost and guessing, maybe I'll try this specialist next, maybe I'll learn I'm allergic to more trees. The people who followed me wanted to feel not so alone. And that's how I felt too. Suddenly, I had thousands of people supporting me, wanting to help, and while I was building this community and finding support in it, I was also brushing off what they were trying to tell me. From the very, very beginning, they kept saying the same thing. Have you been evaluated for POTS? What about POTS? And every time I would say, yep, and my neurologist already ruled that out. I brushed them off because it didn't align with what I had been implicitly taught, which was to trust my doctors over my own lived experience. So even with thousands of people pointing me in the same direction, I kept moving forward within the system the way I had been taught. I saw 4 specialists at Cleveland Clinic. They ran an enormous amount of testing, and while they ruled out so many possibilities, they too missed all of my diagnoses, and there's quite a few. After that, I was back to square one, and I came home devastated. And that's something my followers understood too. When you're chronically ill and you've been searching for answers for so long, navigating a system that often places the blame on the patient, and you keep hearing everything looks normal, or this is non-specific, you start to dream of the day you'll hear, we found something. And it's not because we want attention. It's not because we want to be sick. We are sick, we're suffering, and we want to know why. And how does a patient end up feeling like this? Hoping something will come up wrong on the tests, hoping that will be it. You don't just wake up on day one feeling that way. No, it's the cost of illness, the cost of navigating a medical system where you do not fit neatly into the boxes it is separated into. When you have an illness that's not easily understood or diagnosed, you are very often, and a lot of the time by more than one doctor, gaslit, dismissed, mistreated, and made to feel as if you are making it all up. It's in your head. Your labs are normal, they tell us, and we feel anything but normal. That is a conversation that is constantly taking place in the chronic illness community. in person and online. So while I was sitting in that post-Cleveland Clinic brief, still with no answers, my community was still saying what they've been saying from the very beginning. What about POTS? In October 2023, one of my followers turned close friend pointed me to a neurologist who specialized in dysautonomia and POTS. She said this doctor is going to be switching hospitals mid-October. Her schedule will open October 1st. She will not have a wait list. Call and get in. I was able to get in to see this doctor within 2 weeks. I was her second patient on her first day. She hadn't even been trained how to use the systems yet, but it was still the most productive appointment I had ever been to. She listened to my entire story. She knew what to look for. She ordered the appropriate testing. And when I had that testing done, tilt table test, they strap you to a table and tilt you up and see how sick you get. So fun. When I had that testing done 2 weeks later, it revealed exactly what she thought it would, that I had POTS. I didn't get there because the system worked. I got there because I had the privilege, support, and resources to navigate a system that wasn't designed for me. And the thing about navigating the medical system with chronic illness is that it requires so much labor from the patient. Either we learn how to and have the resources to continue that labor, or we get left behind and lost in the system. Here are just a handful of examples in different categories of the labor we have to do on a regular basis to stay afloat in the medical system. We must schedule and go to tests, appointments, procedures, research conditions, doctors, treatments, coordinate between specialists, fight with insurance, Excellus, Blue Cross Blue Shield. Anyone here? They're lucky. We have to prepare for appointments by gathering our records, making medication and symptom lists, practicing what we are going to say to most effectively convey how our illness or symptoms are impacting our lives. This labor is just one of the outcomes caused by gaps in a system that's built around so much separation. And I don't think where these gaps are is a mystery. Patients are telling us where the gaps are. They're telling us when they're going to social media and asking, has anyone else had to see 10 different doctors who think there are 10 different issues going on? There's fragmentation of care. Patients with complex conditions are sent from specialist to specialist to specialist, often with seemingly unrelated symptoms. They're seeing GI for 3 symptoms, cardio for 2, neuro for 1, but no one is responsible for connecting them. Patients are telling us where the gaps are when they say, I was diagnosed with IBS, but I still have a bunch of other unexplained symptoms. There's a pattern recognition gap. Providers are typically trained in isolated specialties, and this siloed clinician training model can make it more difficult to recognize complex and overlapping conditions. Patients are going to social media and asking, does anyone have any idea about what I should do next? That tells us there's a care coordination gap. Patients are left with puzzle pieces that no one has put together. In the absence of clear medical guidance, patients are left to try to solve the puzzle on their own when most of the time they're not equipped to do so. They're not a healthcare worker. They're not trained in the medical field. And patients are saying, I've been waiting to see this specialist for more than a year, and now they're not even in network anymore. They're telling us there's an access gap between specialist shortages, referral pathways, insurance requirements. When patients are able to begin to figure out the care that they may need and who they need to see, they may not be able to access it. All of these gaps lead to outcomes like increased patient burden, extended wait times, incomplete treatment, delayed care, and often progression of symptoms before diagnosis and treatment. So patients are telling us where those gaps are, and in the absence of clear medical guidance, we're seeing them go to other patients who have experienced and lived the same things. I think that our experiences as patients are invaluable, and that they should be taken into account far more than they are. Patients with complex conditions are really good at tracking patterns. We have to be. What activities make my symptoms worse? What treatments are helping? What foods do I need to avoid? What pathways are leading to answers? All of that information is online, on TikTok, on Instagram, on YouTube, Reddit threads, comment sections. It's all just sitting there. What if we take the millions of patient experiences, already being shared online and use them to build data infrastructure that can recognize patterns across patients and conditions who don't fit neatly into the separation our system is built around. What if this infrastructure could recognize symptom clusters and suggest validated care pathways? For example, a patient presents with tachycardia, lightheadedness, dizziness, fatigue. It could automatically flag potential pathway POTS, run orthostatic vitals in office following POTS protocols, refer to Neurology for autonomic testing, and because we know there is such a high rate of misdiagnosis in POTS patients, it could also prompt, must be ruled out before defaulting to an anxiety diagnosis. If the system can recognize a pattern that millions of patients have reported, it could significantly shorten diagnostic timelines and dramatically reduce rates of misdiagnosis. This same thinking could be applied to the areas where patients are doing the system's work, like coordinating their own care. Many patients with complex conditions end up with care teams spanning several specialties. I have Neurology, Hematology, Rheumatology, Gastroenterology, Neurogastroenterology, Endocrinology, and I'm sure at least 5 others that I can't think of right now. When gaps like missed pattern recognition and lack of care coordination exist, patients are often left to connect those pieces themselves. What if that pattern triggered action? If a patient is seeing 3 or more specialists within 6 months, that could automatically flag them as potentially complex and in need of coordinated care. They could immediately be assigned a care coordinator who initiates regular case reviews across specialties to align their providers around a unified care plan and ask, why is the patient being bounced around and what can we do about it? Acting in this way will remove the burden of coordination from the patient. Care should not be more of a burden than the illness. And as we're talking about patient experience and how we can use it to close gaps in the system, I am reminded of the toll of chronic illness and the weight it can carry. I think that weight should be reflected in how seriously we treat patient experiences, not just as stories, but as inputs for change. What if we treat patient experiences as valid clinical information? Maybe they're not considered anecdotal anymore. Maybe they're considered evidence. For example, if large numbers of patients are consistently reporting being misdiagnosed or having their symptoms dismissed, it's not enough for us to just acknowledge that pattern. We have to change something tangible. It should be reflected in how clinicians are taught, what patterns they're trained to recognize sooner, and how guidelines are written, so that conditions that show consistent patterns of being misdiagnosed are considered much earlier in the diagnostic process. It should not take an average of 7.7 years to get the correct POTS diagnosis. And that story is true for millions of conditions, not just POTS. Right now, our medical system does not account for the millions of patients with complex conditions who cannot fit neatly into the specialties, standardized protocols, and insurance structures it's built around. When the system is not designed for you, it's easy to slip through the cracks. I've been sick for more than 4 years. I've seen far upwards of 20 providers. I've gone to hundreds of appointments, tests, and procedures. To put it in perspective, in 2025 alone, I had 207 test appointments, procedures. I've had 71 so far this year, and it's only April. I was diagnosed with POTS in November of 2023, and even now, 2.5 years later, we are still trying to find treatments that will return some semblance of normalcy back to my life. In this, I am not an outlier. The burden of chronic illness is heavy, but not just because of the illness. It's the labor of navigating a system that's not designed for you, being passed from specialist to specialist with no one trying to connect the pieces, and being left to connect those pieces yourself. It's the constant search for the right specialist and the barriers that make access difficult even when you find them. It's knowing something is wrong in your body, and because what's happening in your body is not well understood or not well recognized, you are gaslit, dismissed, and mistreated. It's the constant pursuit of answers. The burden of chronic illness is so heavy that it's enough to make patients start wishing, please, just find something. No one understands these gaps in the system better than the patients navigating them every day, and yet our experiences are often dismissed as anecdotal instead of being used to create change and to make space for people with complex conditions who don't fit into a one-size-fits-all structure. It's not a mystery where the gaps in our system are or what needs improving. Patients are telling us. Are we listening? Stepping back from the separation our medical system is built around is how we reduce patient burden and misdiagnosis rates. It's how we shorten diagnostic timelines and ensure patients are receiving the correct care they need and deserve. I'm not naive to the reality of implementing change in a system like ours or what it would cost. But there's already a cost of a different kind, and it's being paid by patients in the form of delayed diagnoses, worsening illness, and lost time. Thank you.